Greetings and thank you for joining us for today's webinar called Turn Up the Gain. Are you getting what you should be getting out of LSVT LOUD and LSVT BIG? This webinar is brought to you by LSVT Global. And before we go any farther, we would like to acknowledge the funding support that LSVT Global has received from the National Institutes of Health, the Michael J. Fox Foundation, the Parkinson's Alliance, and the Davis Phinney Foundation. And this important funding has made treatment research possible so that we can deliver you this great information today. My name is Laura Gousset. I'm a physical therapist and one of the LSVT BIG Training and Certification Workshop faculty, along with my colleagues Heather Ciance, who's also an LSVT BIG certified physical therapist and faculty member, and Angela Halpern, who will introduce in a little bit more detail in just one moment. So in terms of logistics, you may have been at one of our previous webinars, but if you haven't, I'd like to give you a little bit of an introduction on how these webinars work. We're going to be doing a presentation of today's topic, and at the end of the webinar, there will be some time for questions and answers. And at that time, you can ask your questions live, which is a really fun part of these webinars. One way is to type in your question into the question box on your control panel. And once you send that, we will be able to see the question and we'll read it aloud without your name and provide you an answer to the question so that everyone can hear the question and the response. The other way is that you can raise your hand, and on your control panel you might see a little hand icon. Once you click on that, we'll see that your hand is raised, and we'll find out who is raising their hand. We'll call out your first and last name so that you know that your microphone has been unmuted. And after that, you can ask your question out loud and we'll answer it. The third way is that you can simply email info as an information at lsvtglobal.com anytime. If you run out of time for your question or think of a question later, we always have on deck clinical experts who are really happy to address any type of question you might have related to LSVT BIG or LSVT LOUD. So today's webinar is all about the topic of helping you learn how to ensure that you're getting the best outcomes possible with LSVT BIG and LSVT LOUD, and that's why we titled it Turning Up the Gain. So briefly, Heather and Angela are our two presenters today. Heather's a physical therapist and has many, many years of experience specifically treating patients with Parkinson's disease and all sorts of atypical Parkinsonisms as well. She works for the Dan Aaron Parkinson's Rehab Center in Philadelphia. She's a geriatric clinical specialist and is a worldwide leader in education for other clinicians on Parkinson's disease. Angela is our Chief Clinical Officer of LSVT LOUD and is also one of the LSVT LOUD training and certification faculty members. And Angela as well has extensive experience working with adults with neurogenic disorders, especially Parkinson's disease. So very happy to have both of them joining us for today's webinar. The learning outcomes are these. By the end of this webinar, we hope that you'll be able to identify some issues that lead to people with Parkinson's having functional difficulties with movement and communication. We want you to be able to describe the key ingredients that make exercise effective in treating the symptoms of Parkinson's disease. And lastly, we're going to show you some ways that you and your therapist can work harder to achieve the best results possible during LSVT LOUD and LSVT BIG treatments. So with that, we're going to have a couple of polling questions to get this started. We really want to know a little bit more about who is joining us today. And so I'm going to launch this poll in just a moment. If you are a person with Parkinson's, a caregiver or a family member, a therapist, a different healthcare professional, or a different person. So just give me one second, excuse me. And the poll is in progress. I'll give you a minute or so to answer that. And it looks like almost all of the results are in. And it looks like half of you voted, and all of you who voted said that you are a person with Parkinson's disease. I'll just share those results with you so that you can see that as well. Okay. I'm going to move on to the next polling question here. The next polling question is this. If you are a person with Parkinson's disease, have you ever received LSVT LOUD, LSVT BIG, both, neither, or maybe you're not sure? And go ahead and vote when you're ready on that. In just a few more seconds. Okay. And it looks to me like 60% of you have received neither, 20% have received LSVT BIG, and 20% have received both LSVT BIG and LSVT LOUD. So thank you for sharing that information with us. That really helps us to gear our presentation to you today. Okay. So now I'm going to turn it over to Heather, and Heather is going to introduce the topic of how Parkinson's disease affects communication and movement.
Thank you so much, Laura. It's really a great opportunity to be here with you today. We feel very passionately about what we do, and we hope that we're able to impart that passion back to you and help you to find the best therapy out there possible for this. So to help you understand a little bit more about LSVT LOUD and LSVT BIG, first we need to have a better understanding really of how does Parkinson's affect your movement and your communication. So we're looking at some things we call motor symptoms. First and foremost, bradykinesia. That is the slowness of movement. You can also have slowness of speaking, and you can also have slowness with your thinking. The second motor symptom is hypokinesia. So hypokinesia is that smallness. We're looking at patients with posture that's a little more bent over, the smaller steps that you take, the reduced arm swing, meaning that you perhaps have one arm that sort of hangs at the side and doesn't fully swing back and forth. It may manifest for you with very small, tiny handwriting, and when it comes to your voice, it actually may be a reduction in the volume of your voice, where people are having difficulty hearing you and they're asking you to speak up time and again. Another motor symptom is rigidity, and you will most likely feel that in stiffness or tightness, and that is in the trunk. It can also be in the arms and the legs. A lot of people suffer from tremor, and tremor can be on one side and then eventually on both sides. Some people talk about internal tremor as well as tremors in the legs. And then also in the motor symptom category, we have postural instability. And basically that's a fancy word for problems with your balance. So any kind of difficulty with regaining your balance, having loss of balance, actually having falls, and then also being fearful of falling. Let's look at the next slide. So we also have a host of symptoms that we refer to as non-motor symptoms, and many people will talk about how these non-motor symptoms can be just as difficult to manage and deal with as the motor symptoms. So apathy, and this can be the person who once was really the life of the party and really had great ideas of things to do and was quite motivated, now just doesn't feel as good about what they're doing and isn't showing as much interest. We know that people with Parkinson's disease suffer with more anxiety and depression, and we also know that there are processing problems, so difficulty with figuring out, how am I supposed to turn around safely? What was it that I was supposed to do? What did my therapist tell me to do? I'm having difficulty staying organized. Maybe I'm having a little more difficulty with my memory and the ability to remind myself of talking louder or being able to feel good and happy about what I'm doing. So there are lots of difficulties with this. And also this reduction in sensory awareness. And what we're referring to there is your difficulty as a person with Parkinson's disease being aware of how loud or how quiet your voice is, or how small or how slow your movements are. Often when we work with individuals with LSVT BIG and LSVT LOUD, and we're asking you to move in a bigger way or talk in a louder way, you feel that we're making you move too big and we're making you yell. You have a difficulty with the awareness of what you're doing, and that's where we come in to help you. Another non-motor symptom is orthostatic hypotension, and again, that's a fancy name for meaning that your blood pressure does a quick drop when you do position changes. So if you've been lying down and you stand up too quickly, or you're sitting and you stand up too quickly, you may feel a little lightheaded and dizzy. And there are many other symptoms that go on, but these are some of the ones that we just wanted to start with to help you have a better understanding of what's going on with your movement and communication. Let's go on to the next slide. So these challenges are real. We acknowledge that these are difficulties that people are facing every day in living with Parkinson's disease. But we are here to tell you that there really is true hope, and there really is true potential for positive changes to be made in your ability to move safer, faster, better, and your ability to communicate and to stay organized and to really effectively communicate your thoughts to individuals. And we're going to talk to you about how we keep that hope and that potential for positive change alive through using these techniques. Next slide. We'd like to start off by saying that it truly is a stunning time to be in rehabilitation today. I've been a therapist for over 20 years, and I can attest to how much effort and time has gone into research and what we know today versus what we knew even just 10 years ago. We know that basic science and research are showing us that there truly is a value in the type of exercise that you do when you have Parkinson's disease. It's not only just medications, it's not only just deep brain stimulation surgery. We really can use exercise to help people. We've learned to identify what we call the key principles of exercise that drive something called activity-dependent neuroplasticity. What we're talking about with neuroplasticity is brain change, the brain making changes to help you to become more able-bodied with your movement and with your voice. And we're going to talk a little bit about those principles, and those principles are intensity, how hard you're working out, repetition, how often you're performing your program, salience, which means we're doing things that are important to you that you want to get better with. Complexity means we're going to challenge you, and that we're talking about timing, that we really want to work with you as soon as possible in your diagnosis to really make the most impact. We also know that we have demonstrated that exercise truly can make your brain function better and may actually slow the progression of your symptoms. So that is not possible through the medication and through the surgery. So the ability to say that exercise may be able to slow your progression is really a fascinating and wonderful application. So remember that your exercise is also your medication. Next slide. What we all know, like I said before, is that our exercise is medicine. I would never tell one of my patients with Parkinson's to stop taking their medication, nor would I ever tell them to stop their exercise. But even though exercise is medication, it's still crucial for you to take your medication just as prescribed. So the right dosage, the right time, the right number of times a day. And when you take your medication as prescribed along with your medication, or I'm sorry, your exercise, you're really going to achieve the best results and benefits. Next slide. What are we talking about when we talk about the research? We have research that backs up these neuroplastic changes. So let's take a few moments to look at what does the research tell us particularly. So we're looking at here the key ingredients in our mixture, if you want to say, of exercises, and how do we push the treatment session to affect those motor and non-motor symptoms. Well, we talked about this a little bit before, the intensity. It's how often are we working with you? How hard are we working with you? Are we forcing you to work harder than you think is possible? Are we forcing you to work to a challenging level that we're getting your heart rate up. We're making you work out to a great level. We're also talking about specificity. That means that we're training to the deficit, meaning what is the difficulty that you're having? Is it slowness of movement? Is it quietness of your voice? Is it difficulty with your posture? So we're specifically going to target those problem areas. And then we're going to make it important to you. It's going to be salient to you. It means that it is not the same exercise program for everyone. It is individualized to your needs. It means something to you. It is rewarding to you, and it's going to help you to be the person that you want to be. And the way that we push through that, too, is with complexity. We're going to make it as challenging as possible for you in the clinic so that when you leave us and you go home, that we hope that there is nothing that you're faced with that you can't tackle because we've pushed you so hard in the clinic. Next slide. This September in Portland, Oregon is going to be something called the World Parkinson Congress. It comes around every 3 years, and we're lucky enough to have it back in the United States this year. And leading up to the conference, which is open to researchers, clinicians, people with Parkinson's disease, care partners, anyone, on the way leading up to this, they are providing us with a series of little webinars and informational seminars. And this was one that was originally presented this past October by 3 really well-known researchers in the field of exercise with Parkinson's. And they agree, they say what we said before, that you really do need to be optimized on your medications first and then learn about your exercise. Your treatment can't be one or the other. It truly needs to be a 50-50 split of the best medication program and the best exercise program. And what is the best kind of exercise? Well, one of the exercises that needs to be a part of everything you do is something aerobic. That means that we need to get your heart rate up. And when we get the heart rate up and we're pumping blood through the body, it's increasing the amount of blood flow to the brain, and it really bathes the brain and allows the brain to have change. It allows new connections to be grown. We also know from this that exercise should be skill-based, like I mentioned before. We want to work on the things you're having difficulty with, and we want a variety of exercises. We don't want it to be boring. We want it to be challenging for you, and we want to push you out of your comfort zone so that eventually you will be comfortable with everything that you're doing. Next slide. So this is a little summary of research that was also done by a leader in the field of exercise and Parkinson's, and it's kind of a lengthy title, but it is Exercise-Enhanced Neuroplasticity, Targeting Motor and Cognitive Circuitry in Parkinson's. So basically, we're talking about what type of exercise, again, is going to help people with Parkinson's disease think, speak, and move better. And the synthesis of this research, again, shows that you need to have a goal. We want to practice an actual skill with you, and then again, we need to get your heart rate up. They also found that when they looked at the research that a supervised environment is best. They found that people who just exercise on their own, who try to figure out this without some real guidance, really don't fare as well as people who are actually in a supervised environment of a physical therapist, an occupational therapist, or a speech-language pathologist. And you're going to learn best when we give you instruction and we give you feedback and we help to reinforce good movement and help you to be aware of when your movements aren't as good as they should be and how to make them better. And the way that we're giving you feedback is going to help you as well. We want to engage you. We want you to be motivated. We really want you to feel challenged, but to the point that you can overcome that challenge, because we need to teach you how to become more aware of the size and speed of your movements as well as the volume of your voice. You may not have been quite as aware of these things before, and it's our job as therapists to now draw your attention back to these areas so we can help you to correct them.
Well, thank you, Heather, for that great introduction. I'm now going to take over and talk about how do the LSVT protocols fit in with this foundation and groundwork that Heather just introduced to you. So for those of you who have had LSVT LOUD or LSVT BIG, you can be thinking about your experience and applying that to how we're talking about you can push and drive to get the most out of those treatments. Maybe you're doing the treatments now. For those of you who haven't had the treatments, we'll introduce those topics to you so you can see what LSVT LOUD and LSVT BIG are all about. When we look at the LSVT protocols, we really do like to highlight for you that they're based on 25 years of federally funded, that's funding from the National Institutes of Health, research and clinical experience. The reason this is so important to highlight for you is if you are going to spend your time, your effort, your insurance dollars on a speech therapy, physical or occupational therapy, you want to make sure it has research evidence behind it so that you know you're doing a treatment and participating in a treatment that has efficacy data to show that it works. LSVT LOUD is the speech treatment. LSVT BIG is the physical or occupational treatment. LSVT LOUD is delivered by a certified speech-language pathologist who has gone through a 2-day training and certification course to be able to say they're LSVT LOUD certified. LSVT BIG is delivered by a physical or occupational therapist who has also gone through a 2-day training and certification course to say that they're LSVT BIG certified. That certification notification is also important because in those 2-day trainings, the therapists learn how to do the treatments according to how it's been researched over the last 25 years. So if you're going to participate in the treatments, you do want to make sure the therapists you're working with have gone through that training and certification. Next slide. When we talk about the LSVT protocols, they are structured, they're evidence-based, as I said before, and it's a rehabilitative treatment protocol that was developed specifically for individuals with Parkinson's disease. So this is something else that makes it really unique. When we look at and think back to what Heather introduced about what might happen with voice and speech and movement in Parkinson's disease, these treatments were specifically designed to target those aspects, and we're going to get into that in a little more detail. They adhere to principles of motor learning and activity-dependent neuroplasticity. So the protocols are intensive. It's challenging exercise with the exercises developed to be specific to those unique features of Parkinson's. And we'll talk also more in depth about how they're personalized and specific for what you need. This is another thing that makes them a little more unique. It's not just walking on a treadmill to walk on a treadmill, or doing an ah to do an ah. Everything has a purpose to work towards function in your everyday life. Next slide, please. We do want to highlight that LSVT LOUD and LSVT BIG are separate protocols. So you're not doing LSVT LOUD and LSVT BIG together in 1 hour. Rather, you would go through LSVT BIG with the physical or occupational therapist and then have separate sessions of LSVT LOUD with the speech therapist. For purposes of this presentation today, we're talking about these approaches together because they are based on the same fundamentals, but do please keep that in mind as we go through. These are separate protocols. Each protocol, so LSVT LOUD or LSVT BIG, is delivered 4 days a week for 4 weeks, so you're receiving 16 sessions in 1 month. Each of those sessions is 1 hour in length. It's individual, not group therapy, and that's really important so your therapist can push and drive what you need. You will be given daily homework practice. It doesn't take long to do, and daily carryover exercises. The homework and carryover are not extra or separate. They're an essential part of the protocol so that you can practice what you've learned in the treatment room outside of the treatment room to get that generalization. And your therapist will develop a lifelong habit of continuous practice. These are exercise protocols, so you need to continue to exercise, to practice, to maintain those benefits. Next slide. I'm going to show you a snapshot now of an LSVT LOUD treatment session. So this is just a quick picture of what would happen in that 1 hour treatment session. The first half of the session are the daily exercises, And these are done every one of the 16 sessions. These are really your core building blocks to get the voice and speech strong. And they provide that foundation to then use that strength that you've learned in these core exercises to apply it to functional communication. So you will do some sustained phonation, a minimum of 15 of those repetitions, getting to a target loudness and holding it longer and longer. There are some pitch stretch exercises, which are the high and low ahs. And the reason that we do these is sometimes in Parkinson's, people's voices can become monotone. So these are not singing exercises, but rather exercises to help with that pitch inflection in speech. And so we start with an ah, ah, and stretch up, or start with an ah, ah, and stretch down. And individuals are pushed to their limits where they can go higher and lower phonations. The next activity is coming up with 10 phrases that you say every single day. And these are completely based on you and what's functional and important to you. So some of my patients have had phrases such as, "Where's the remote?" or "Have you seen my car keys?" or "It's cocktail time," whatever they might say every single day. We then practice those phrases 5 times each session so they become so overlearned that when someone goes home and happens to say, "What's for dinner?" if that was one of their phrases, they've practiced it so much in their loud voice that it sparks them, reminds them to be loud in their conversation. The second half of the session is the speech hierarchy. Here we start simple and gradually get more complex, incorporating that strong, good quality voice that was learned in the first half of the session that's at normal loudness. And so we start with reading and conversation at the word phrase level, week 1, going to sentences, week 2, paragraph reading, week 3, and by week 4, we're doing all conversation practice of a normal loudness voice. And incorporated throughout all of this are homework and carryover activities to practice what was learned in the treatment room, outside of the treatment room. Next slide. When we think of the principles of neuroplasticity, we know that intensity of practice is important to make change. When you look at the number of repetitions involved in 1 month of practice, as shown on this slide, this provides you with a quick look of that intensity of treatment. So as I mentioned on the previous slide, for the sustained phonation or the ah, you're doing a minimum of 15 of those each session. And so when we look at the total repetitions in a month, we can see we're getting up to 504 repetitions. This really is a clear picture of how LSVT incorporates that important principle of intensity into your practice to make change. I'm now going to turn it back over to Heather so she can give you a snapshot of what an LSVT BIG treatment session looks like.
Thank you, Angela. So when we look at our LSVT BIG treatment session, you'll see that there are similarities based off of the LSVT LOUD. We do start with some maximal daily exercises. We have 7 exercises. Some are done in seated position, some are done in a standing position, and all can be adapted to whatever position you need for your safety. Now, the exercises are important because they teach you how big you are to move and how much effort you are to do. And these exercises then help you to link into your functional movements, because that's what it's really all about, is how can we help you every day to make the quality and safety of your function bigger and more effective. So once we complete the exercises, we move into something called our functional component tasks. So if you think about what Angela talked about with the functional phrases, now we're moving into functional component tasks. And these are 5 everyday tasks that you will choose with us. You help us to figure out things that you do normally every day that you feel are important to you, that you want to keep fresh with, and that you want to provide more effort and do better. So some of those are simple things like sit to stand. Everyone needs to be able to do a sit to stand transfer. And then some of our patients will choose things like to pull your keys or your wallet out of your pocket. It may be being able to take your glasses on and off your head. It may be beginning to sit down and type your name into your email account. So whatever that specific task is, we specialize it to you. Then we also work on walking big. So the distance can vary, the time can vary. We can change the location. We can walk indoors and outdoors. We will work on things with you such as making turns, climbing curbs, climbing stairs. Any place or any condition that you're going to be faced with having to walk, we're going to work with you on that. We're going to use your assisted device. If you're someone who needs a rollator, we will continue to help you to be safer with that device if needed. And then we have our hierarchy tasks. So you heard Angela use that term with the LSVT LOUD, and when we talk about that with the LSVT BIG, we're talking about, again, tasks that are important to you. These are larger scale tasks, things that have lots of different steps on them. So the ability to be able to get on and off the bus by yourself, if you wanted to go hiking, the ability to be able to get out of bed, walk to the bathroom. Perhaps you want to be able to meet your children and grandchildren somewhere, that you do an activity once a week together. Whatever that task is, we will help you with that. And then, like Angela said before, we're also going to help you to use the principles of what we've taught you in the session to take it home, to carry it over into everyday life, and to use those big movements and that big effort so that you have a daily assignment to take home and put to place every day to really help remind you of what you're doing. Let's move to the next slide. And we're going to talk again about intensity. So Angela spoke earlier again about the intensity of the treatment when it comes to the LSVT LOUD, and now on this slide you can see the numbers for the amount of exercises and the amount of time we spend when we're going through those with our individuals doing the LSVT BIG. Our sustained exercises where we actually have you hold the posture, you can look and see that's close to 400 repetitions. When we do our repetitive exercises where we're stepping and we're changing directions, we are over 1,200 repetitions. Those 5 functional component tasks, 400 repetitions. And when we look at the amount of time that we put into practicing with you, your walking, and then your hierarchy skills, those bigger skilled tasks that you do, you can see how much time we are truly driving you to do this. And we start out simply, but we don't keep it simple. We continue to make it more complex, more challenging, and more difficult across those 4 weeks of treatment while we're with you. Next slide. I'm going to turn this back over to Angela.
When we think about, and you've seen these 2 charts now that have the number of repetitions, please don't think that that means, oh, I'm doing this again, and I'm doing it again, and I'm doing it again. Repetition does not equal complacency. What we mean by that is as you're doing all those repetitions of a part of LSVT LOUD or LSVT BIG, you're not just repeating for the sake of repeating. But on each repetition, your therapist is pushing you to make sure your performance meets the target goal. If it does meet the target goal, so you have the movement that your physical therapist is looking for, or you have the loudness your speech therapist is looking for, then your therapist is going to push you for even more. That's how you continue to increase your gain. For example, for the if I have someone that has that loudness I'm looking for, I'm going to have them go longer. Or perhaps you're walking and you have the movement that your therapist is looking for. They might have you add voice to make that more demanding, or add another type of dual task. So the idea is throughout this repetition, we're always pushing and driving for more. It's never boring. Repetition is not a complacent activity. Next slide. When we look at the exercises, it isn't just about the amount of treatment, but it's also about how hard you work during the treatment. So I'm going to have Heather introduce these concepts from the idea of LSVT BIG, and then I'll follow up with LSVT LOUD.
Well, thank you, Angela. So we really are going to push you. So when we talk about pushing you hard, we mean it. We're going to get you to increase your amount of effort. Most individuals with Parkinson's, like we said before, will self-select a slower or smaller pace of their movement and perhaps a slower and smaller voice. And people are not aware of this, so it is our job as therapists to really push that high effort. Now, how do we push the effort with you? We are talking about the size, the amplitude of what you're doing. We are keeping it big. That means that you're not only big while you're doing the exercises with us. If you stop and you take a break and you walk over to the water cooler to get a glass of water, we're watching how big you are standing, how big you are walking, how big you are reaching for that cup of water. So we're really forcing you to keep that size up the entire time. We're forcing you with the effort of the number of repetitions. So we may start out with a lower number and then keep increasing it so you have more opportunities to really get that practice and to kind of stick the landing if we talk about kind of a gymnast reference. Then we're also pushing you with that high effort by giving you some sort of a force or a resistance. So that means that maybe we now are putting on some Velcroed weights onto your ankles or onto your wrists. Now we're pushing you to hold that exercise for a longer amount of time. And then we help you to really get it correct. So we want you to be accurate with it. We don't want you to be losing your balance, to be losing the intensity of how you're pushing it and then kind of starting again and starting over. We're looking for you to really get that accuracy with the motion that you're doing so that you feel the safest that you can. And then lastly, we're pushing you with that high effort to the point of fatigue. And we mean a healthy level of fatigue. We're not looking here to cripple you into absolute fatigue so that you feel terrible and don't want to return. We're looking to push you to the point where you should be if you're doing an appropriate exercise program. We're looking to get your heart rate elevated to an appropriate level. You should be sweating a little bit and you really should feel a little breathless, just like you would with any kind of new and challenging exercise program. So Angela is going to talk now a little bit about how she pushes with the effort for the LSVT LOUD.
Thank you, Heather. And with this, you can keep those same fundamentals in mind that Heather just introduced you to. LSVT LOUD is parallel. So when we talk about amplitude with voice and speech, we're talking about increasing amplitude or loudness to normal loudness. And we'll get more into the sensory issues in just a bit, but keep in mind when we're saying loud, we're always getting people to normal loudness. As Heather was mentioning, we're watching that through the whole session. So if I've just had someone read a page of material about something that's personal and interesting to them and they've had a great voice, at the end of that, if I ask them a question about it, I'm expecting the loudness to be just the same when they answer that question as they did while they read. Anytime that voice drops down, I'm going to have someone correct that and get that amplitude back up. The repetitions, we're incorporating those multiple repetitions to always push and drive throughout. And then with the force and resistance, how we do that for LSVT LOUD is we are always looking for this good normal loudness voice. And so if someone can achieve a good normal loudness voice on the sustained phonation, I'm going to have them go longer. If they can go longer and they're still at normal loudness, I might add a motor task, have them get up and walk around while they're still doing that voice. For reading, if I get a good loudness voice as I progress through the weeks of the hierarchy, I'm going to make that material more complex. I'm always pushing them for more. Accuracy, as Heather mentioned, we have a target. We want you to be accurate with these productions so that you're doing them well as we're pushing and driving. So for LSVT LOUD, what that means is normal loudness with a good quality. Your therapist will not allow you to have a voice that is harsh or tight or strained or not healthy voice production. It always must be normal loudness with healthy voice production. And with that fatigue, many of my patients when they first come in don't think of voice exercise or voice therapy as exercise. And they're surprised at the end of a session when they might say to me, whew, that felt like a good workout. It is. We are pushing and driving, and voice speech therapy is exercise when you're doing LSVT LOUD, and that drive is important to make change. Next slide. And now Heather's going to talk to you about fatigue a little more in depth related to BIG, and then I'll talk about it in relation to LOUD.
So again, behind everything that we're talking about, we have research to talk about this. So we want you to know that, again, what Angela said before about training loud, meaning that we're training you to the point of normal loudness. And that is the same thing when we're talking about big. We're talking about those big movements, and we're talking about pushing the intensity to make you tired. What we really are meaning is that we need you to move big so that you actually move normal. So we push you to the point of normal movement, but you have to push yourself beyond that in your feeling of your intensity. So like I said before, it's really a good workout fatigue. You know, I want you to say to me, that was hard work. Wow, that was a great workout. Heather, you're relentless. You're not letting me get by with anything. That's what I want my patients to feel. I want them to know that I'm really there to coach them and motivate them. And we have to make sure that we have a good understanding of what a workout is versus an actual pain or a strain. We never want to put anyone in any kind of physical danger of having a loss of balance, of hurting a bad shoulder, or someone who may have had a recent hip replacement or any kind of surgery. We're going to work within those safe physiological limits for you. So please know that when we're talking about keeping it intense, we're also talking about keeping it within a safe range for you. And again, I spoke before about your self-perceived capacity, your belief in how well you're doing or how poorly you're doing, and how oftentimes people with Parkinson's aren't aware of how slow they might be walking or how quiet their voice is. And we really are there again through that intensive drive to really get you to push beyond those levels. So we're going to help you to feel comfortable with pushing beyond those levels so that we really can make that change in your brain and make that change in your quality of life. And Angela is now going to talk about that role with the fatigue a little bit more with the LSVT LOUD.
When we think about fatigue with LSVT LOUD, we also want to differentiate that good fatigue from the bad fatigue. So with LSVT LOUD, as you know, when a good fatigue, if you've gone to the gym and worked out, you feel tired, but nothing hurts. And so it's the same thing when we think about your voice. Your voice may feel tired, but it doesn't hurt. And that tiredness, that fatigue, means you've been pushed, that we've been driving that to try to make change. What you should never, ever have during an LSVT LOUD session is pain or feeling strain as a part of the exercises. Clinicians are trained in the training and certification they go through of how to shape the voice so that they're achieving this increased loudness, which is normal loudness, but with good quality. So there should never be any strain or any hyperfunction as a part of that treatment session. Always just that good fatigue. And then with the fatigue, as you continue to practice, many people notice that that fatigue gets less and less because the voice is getting stronger. Next slide. The LSVT protocols specifically target the deficits that Heather introduced to you at the beginning of the presentation that are unique to individuals with Parkinson's disease. And that's one thing that's special about these treatments, LSVT LOUD and LSVT BIG. They were designed specifically for individuals with Parkinson's disease. And in this next slide, Heather's going to introduce you to this first concept. LSVT BIG specifically targets this, and then I'll talk about it in relation to LSVT LOUD.
I love this picture because it oftentimes really explains what people are trying to tell me that they're feeling. So the two terms that we have here that we're trying to override, the bradykinesia, that is the slowness of movement, and the hypokinesia is the smallness of movement. So you can imagine if you were stuck walking in deep, thick mud like this, how slow and how small your movements might feel. And that is something that patients with Parkinson's disease deal with on several different levels and several different movements every day. And this can come in various levels. So for some people it may be not as great in the beginning, and as the condition moves on it may become much more problematic. So these are the two things that are really special to Parkinson's disease and special to LSVT BIG, in that we're able to override that. If your movements are too small, your movements are then going to be too slow. So if we can make you move bigger, if we can get you to really reach that arm with an open hand to really grasp that cup of water. Maybe next time, instead of the slow reach and then opening your hands too late and knocking over the water, now you're going to be able to remember, I've got to make that big drive, that big reach, that big grasp, and really lift that cup up to where I'm going. We know that oftentimes when we're feeling slower with our motions and someone tells us to speed up, that actually is a detriment to someone with Parkinson's disease. It makes the movements get smaller and tighter and slower, and they get quick little movements, and that's not what we want. We know that if it takes you 50 steps to walk 100 feet, and then if I get you to walk that 100 feet in 25 steps, I'm going to get you there faster. You're taking fewer steps, and you're actually going to feel more energized because you feel strength and power in what you're able to do. So by making those movements bigger, we override that bradykinesia, and then we in turn override that hypokinesia, because bigger will make our movements faster. So now Angela is going to talk about those two specific symptoms with regard to the LSVT LOUD.
When we think about this in relation to voice and speech, and we think about decreased amplitude, so that hypokinesia across the motor speech system, we can see how that relates to not taking a deep enough breath. So we've reduced amplitude with the respiratory system. Not getting the drive we need to the vocal folds, so a hoarse, breathy voice. Not opening the mouth enough, not having enough effort to the articulators. So all of that is a decreased amplitude across the voice and speech system. The beautiful thing about LSVT LOUD is for the individual participating in the treatment, their single focus is think loud, think loud, think loud. By just thinking loud, you automatically take a deeper breath, open your mouth more, put more effort at the level of the vocal folds, put more effort into the articulators. So outcomes not just increase normal loudness voice, but we see clinically, and we've seen in our research, improvements in respiration and articulation as well. So by that single focus of think loud, we're able to override that hypokinesia. And it's done in a simple and efficient way. Let's now go into the next slide and talk about some of the variety of skills needed when we're looking at improved function, and Heather will start this one off.
So please know that this is not a complete chart. We are talking about things that can be common to people with Parkinson's, but certainly we will individualize sessions for your needs. But there are lots of skills we need that we never think about. When we're thinking about just simply walking, we need to be able to start and stop correctly. So we want to help people who have problems with what we call festination. That's where you feel like you're taking those quick small steps and you're sort of moving like a runaway train. And the opposite is retropulsion, where you have the quick small steps going backwards. So if we're able to train you to be able to do those complete stops and starts, we can really help to prevent those two things. And then as well as the problem of freezing of gait, we can also have what we call freezing of other movements. You can have freezing with the ability to lift a fork to your mouth. You can have freezing with the ability when you're getting dressed to pull up your pants. So again, we need to be able to help people to have a really nice big effort when they're starting and stopping. Now, with regard to making direction changes, we're not just talking about sidestepping in the kitchen. We're talking about moving backwards. We're talking about bending down into the cabinet, getting up, turning, walking this way and that way. We do lots of little movements throughout the day that we really don't think about. The LSVT BIG exercises too, through that repetition and that intensity, you again get that endurance. You build your endurance, your cardiovascular system gets stronger. When we're thinking about other things that affect people, we talked about the balance. Well, the ability to be able to step forward and back, to be able to step up big, to be able to move from sit to stand in a big way and change directions is really going to impact your balance. And all of those things together really help to make you a stronger individual. You're able to hold yourself up in a taller position and be able to grab onto things and hold them better. And all of that together really works toward your functional ability and your true safety and confidence in what you're able to do.
When we think about this in terms of LSVT LOUD, this goes back to what I was mentioning in the previous slide of how LOUD can be a great, efficient, single focus to help a lot of things happen. Our ultimate goal when someone starts therapy is to help someone get to normal loudness where they can be heard and understood in conversational speech outside of our treatment room. So when we're doing the multiple repetitions of the we're working to strengthen the respiration, the phonation, the coordination of speech and breathing with the ultimate goal of that being translated into functional communication. When we're doing the pitch stretch exercises, the idea is increased strengthening and inflection with the ultimate goal of translation into functional communication. And then everything that we work on throughout the reading and conversation activities that are selected to be personal and salient to you are all working towards that final goal of functional communication. And so this will vary depending on who I'm working with. If I have someone who is a real estate agent and they want to be able to keep their voice loud while they make sales calls, that's our ultimate goal, that we're using all of those building blocks to help them get that functional communication in those situations. Or maybe someone wants to have a loud voice to lead their support group meeting. Those are the types of things that we practice on. And with that single focus of loud, you see the change across not just the voice, which is the expected target, but also respiration and articulation as well. Next slide. We mentioned earlier about this idea of the sensory awareness. And in Parkinson's disease, we see what we call is a sensory mismatch. So a difference between how the output feels to an individual and how it's perceived by others. So my patients will say to me when they come in with a quiet voice, my voice feels normal. It doesn't feel too soft, and then I will get them to a normal loudness. They can hear when I play back their voice at its normal loudness, but they'll tell me, I can't talk like that. I feel like I'm shouting. Likewise, individuals may say things like, I had no idea my arm doesn't swing, or my movements feel normal. And then the physical therapist may get you to that normal movement, and people will say, I can't walk like this. It feels too big. It feels funny. So there is this sensory mismatch across the system that is directly a result of the Parkinson's disease, and the LSVT protocols directly target this. We are bombarding the sensory system to help people feel more comfortable with what is normal loudness and normal movement. And I'll turn this next slide over to Heather.
I want to talk to you a little bit about the research behind what Angela was referring to with that self-awareness of how loud your voice is or how small or how big your movements are. And in a study where they looked at 10 motor symptoms, so you remember the motor symptoms that we talked about earlier, bradykinesia, hypokinesia, balance reactions. When they tested people with Parkinson's about these symptoms, most people had these problems. They had reduced speed and reduced amplitude of their movements. The difficulty was that they didn't recognize that they were having them, so they themselves didn't say to the tester, yes, I feel like I'm not swinging my arm. Yes, I'm not sure that I'm talking loud enough. They didn't recognize them, and they also didn't recognize how severe the problems were and how they were impacting their quality of movement. They just may have known that maybe people were asking them to repeat themselves more frequently, or maybe it was taking them a longer time to get dressed. They weren't truly aware, though, of what that underlying problem was. When they moved forward with a study in 2016, they found that most individuals with Parkinson's seem to have more awareness or better awareness of symptoms that they can see. So if you can see that you're having difficulty with walking, that it's taking you longer to get places, that perhaps you're wearing your shoe in a funny way, or that you can see that your arm is trembling and you have those tremors, you're aware of those things because they're right there. But things that you may not be aware of is that smallness and that slowness. And those were the things that, again, like Angela said, we're really going to push you through that so that we can bombard that system and we can really retrain you to have the normal speed, the normal size, and the normal vocalization loudness of what you can do for normal conversations and normal safe movements. Next slide.
So when we think about this intensive calibration training, this is essential to help you generalize what you're learning in the treatment room outside of the treatment room. So this rescaled amplitude for voice and speech and for movement. Your therapist will bombard you with activities to help you, one, become more aware. What is normal movement? What is normal loudness? To help you accept that that is normal. As I mentioned earlier, at first it feels funny. So we do a lot of activities to help you see, no, I'm not moving too big. I'm not talking too loud. This is where it needs to be. And helping you to feel comfortable with that so you can and will utilize that normal loudness voice, the bigger movements outside of the treatment room. And that's where the carryover and generalization tasks will incorporate some in those treatment and give you carryover activities to do outside of treatment so you get those opportunities to practice. So this is where the LSVT protocols really bombard that impaired kinesthetic awareness that we see in individuals with Parkinson's disease and help that to change. Next slide. So the feedback that your therapist will give you helps you to learn the right amount of effort needed for more normal speech and movement. Your therapist will be bombarding you, saying things over and over in treatment, such as, that voice is not too loud, or that movement was not too big. Was that your ah voice? Was that your big amplitude? How much effort was that? And then they might play your voice back or show you a video of your movement so you can see it really is normal. We also ask our patients to internalize and feel the effort required to get to normal loudness, normal movement, because that's what's going to help you be able to carry it over outside of the treatment room without your therapist telling you that's where it needs to be. Next slide, please. The LSVT protocols produce changes that are focused on you, meaningful to you. One of the reasons the protocols are effective is because we look at this principle of neuroplasticity, of saliency, meaning all the activities are derived based on what you want, your functional needs, your communication needs, and then those are incorporated into the treatment. Next slide, please. So your therapists are looking at what brings you joy. What is meaningful and important to you? What do you want to keep doing? And then that's the target of therapy to help you be able to do those activities and to talk in those types of situations. Next slide. All the exercises that are done link to that ultimate goal of increased function for you. So where is it functional for you to have improved communication, improved movement? Next slide. So your therapist will help you create a link between these maximal daily exercises that you're doing, the functional component exercises, the hierarchy tasks, and how that's going to apply functionally for you outside of the treatment room. So they'll talk to you about, what are you having difficulty with? What are your goals? What do you want to work on? Or what do you want to work on preventatively so you won't have difficulties in some of those areas? Next slide. If you understand how these tasks that are done in the treatment link up to your function in your everyday life, which is what your therapist will also help you to see, this will enable you to turn up the gain in your world for that normal movement, normal loudness. I'm now going to turn it over to Heather, and she's going to go through a video interview and case study example with you.
Thank you, Angela. So this is a video presentation of a former client of mine, and I asked him to explain to a student how the actual exercises and programs helped him with his function. So this will give you a good idea of what we're talking about with a real live patient. So explain to Lauren how the exercises help you with functional movements that you do every day.
It makes me realize that I can extend myself a little more, because normally your tendency is to cut short a movement. It's easier to walk in a shuffle with your feet closer together, but when you are conscious of the heel strike, it makes your strides longer. And when you make your strides longer, then the next thing is to think about your hand and your arm. The other thing is, especially the real improvement, the most noticeable improvement is my hand. And I find myself just at rest, putting my hand down and then saying it's got to be open. And I make sure it's open. But you have to consciously think about it and have to have keys, like the heel strike. If that's the key and you're conscious of the heel striking first, it gets you into a more proper posture, and it makes what happens here translate into what happens every day.
Are there any of the exercises in particular that you found especially helpful that are kind of common to what you normally do every day?
I think the functional stuff was great, especially the cutting of the food. Even after the first week, when I went out with my relatives, they noticed that I could cut much better. So that this is the first time I've had functional, and the improvement is considerable. I guess, but the cutting is the most visible because it's the most practiced thing. But that and I never put my shoes on that way. I never threw my leg up and put my shoes on that way. But now I know I can do that if I need to.
Show me how you throw your foot up. Yeah. Nicely done. Thank you. So again, what I really like about that video is it talks about how he had to practice, how he knew he could drive himself, and how really practicing those exercises and those movements carried over into everyday life. So we're going to take a look at the next slide, and I'm going to quickly take you through a case presentation of a gentleman that I worked with. He had Parkinson's for 2 years. He was a retired religion teacher and track coach. He had a very supportive wife, and his daughter, luckily, was a speech-language pathologist. He was really concerned that his lack of affect, his kind of the look of his body, his lack of smiling was really scary to some of the children that he was volunteering with. But he realized that he said to me, you know, I'm a quiet, reserved man. So let's take a look at the next slide, and I'll quickly show you and talk to you a little bit about what some of the things were that he was showing. So he had problems with his walking. He was slower, not swinging his arm. He started to overuse and favor the right arm. He was getting tired. He was losing trunk rotation. He had low voice volume and was running out of breath before he could finish a sentence. He was feeling unsteady when walking outside. He kept looking at the ground and was really starting to have difficulty with lifting his head up and keeping it in midline, and again was worried that the students that he was volunteering with were thinking that he wasn't as friendly as he could be or wasn't as approachable. So I'm going to take you through some series now with the next slides of things that we were able to do in therapy to really help Mr. P turn up his game. We tapped into his knowledge as a track coach, and I said, you know, you pushed those kids hard. You had them do several hours of practice. You had them practice things over and over again, and you pushed them to their limit. We need to do the same thing with you. We tapped into who he was, what was emotionally salient to him, what was important to him, and his strong faith was really important. So we would use that as a motivator. We would talk about how we need to keep up that big posture when he was getting communion at church, and we'd have him say things like amen when he felt like he was doing well. And we kept the tasks and the hierarchy and the walking, again, motivating him to stay active with being a volunteer, and this really helped him to stay on track with that. And then I had mentioned before he was a retired teacher, so what we helped him to do with really was using his presence to command the room, so that he was using his big presence and he was using his loud voice. His therapist's daughter was really helpful in that we helped him to have regular phone calls with her so that she could really keep up with hearing what he was doing. He also had a course of the LSVT LOUD therapy when he completed his LSVT BIG therapy, so this was further continued with that. And the better he performed his exercises and his functional tasks, right away we made them more challenging for him. So these were some of the ways that we helped him to turn up the game. Let me show you another example on the next slide here about Angela moving into the complexity of how we train that for the voice and the movement. So Angela, if you want to start with that.
Yes, so once we have established the quality and the bigness or the loudness that we want our patients to have, and we can go into that next slide, then what we're going to do is to continue to push and drive and try to increase that gain by doing different types of dual tasking. So if we were going to do this, for example, imagine someone doing ah or ah, and if I have that loud, good quality voice established, if I have someone who's an artist, I might have them draw a picture at the same time they're doing their ah, but keeping the same loudness and quality. Or maybe someone likes to play cards, so I'll have them shuffle and deal the cards. Once again, we're having dual task activities be things that are functional and important to you. Or many people say it's hard to walk and talk, and so here you can obviously see how this would work for both LSVT loud or LSVT big, of adding that if someone has the big movement, now I'm going to have to talk and stay loud at the same time, or I have to move while I talk and stay loud. And then we can also add different types of cognitive tasks. So perhaps someone's sustaining ah, and I have them come up with as many words as they can that start with the letter F. Or counting, maybe they're an engineer and they do a lot of math. I have them do math problems in their head. So these are ways that we're never satisfied. We're always pushing for more to increase those gains for our patients. And Heather, I didn't know if you had anything you wanted to add to that one?
Just to reiterate what Angela is saying, it's never just the motor task. We're not having someone just walk. Like she said, they're walking and talking. They're walking and catching something. They're walking and looking around the room. So again, we're never satisfied, and we always push it to the next level. In the next slide, I'm going to actually show you here some other ways at how we help to turn up that gain with those functional component movements. So I talked about using sit to stand, but we didn't just do it from a chair. We had Mr. P sitting on a very low seat, sitting on an unsteady surface. We had him counting backwards. We had him saying all the different birthdays of all the grandchildren in his family. One of his other functional components was the ability to hold his head nice and high and keep up a big smile. Now, we did that too while he was walking around the room, also performing balance activities. Trying to get him to use his left hand more with the seatbelt. We would actually turn on really loud music that he didn't really enjoy listening to, so he had to kind of battle through that external stimulation and still be able to use the big movement with his hand. And then lastly, his last two were things with the hands, again, putting on a shirt. Again, we had him doing this while he was walking. He wasn't just standing and doing it. We made it more challenging. And as well as being able to hold up that book that he was using and hold it in the left hand while he was teaching and volunteering, he was doing that while he was turning, while he was looking around the room, and while he was walking on different surfaces. So again, we always push. We are relentless in how much effort and how challenging we want to push you through this, because we really are applying those principles of neuroplasticity, get the true brain change so that you will move and you will talk with the normal size and loudness of your voice. So I'm going to show you in the next slide one last little shot here of one of my patients showing how we can even make the exercises harder, and I love the effort that he's giving with this. So in our first exercise that we do, where we have patients reach down to the floor and then up to the ceiling and then hold back into posture, you can see that that wasn't good enough. I then put him on a balance pad, and I had him put 2 rolls underneath of his feet, and we would have him count things. And when the counting got too easy, we would have him say, instead of counting to 10, you're now going to name 10 things that your wife would pack to go on vacation. And again, when he did it well, we would make him do it again so that we could really drive home how important it was to get that accuracy and have a lot of fun with it. I'm going to turn the rest of this over to Angela and then over to Laura.
So to wrap up, as far as turning up the game for communication, I gave you some examples back on the grid of dual tasking during the ahs and the highs and lows. When we talk about the second half of the session, which is the speech hierarchy, as you may have remembered earlier, I introduced you to the idea that we start simple and gradually get more complex. So we're doing reading and conversation activities that start simply at week 1 at a word phrase level, and then we push that gain, increase the complexity by week 4 of expecting a normal loudness voice with that increased amplitude all during conversation. Some ways that we might incorporate some of these activities to continue to push are, we always pick activities that are personal and interesting to our patients. So if I have someone who's a baker, week 1, when we're reading at a word phrase level, we might read some recipes. Week 2, we might read recipe directions, sentence level. Week 3, we're reading at a paragraph level, so perhaps they bring in their bon appetit. And week 4, we might talk about a dinner party that they hosted. Throughout these, I'm asking questions that are relative to the level of where we are. So week 1, after those simple phrase reading, I might say, tell me how much sugar you need. And I'm expecting someone's voice to be just as loud on that response as it was when they read. And then by week 3, I might be asking them, tell me how you make the steps you use to make a pie dough. So always making it personal, always making it salient throughout each of these exercises. Next slide. In summary, as you've seen throughout this presentation, exercise for individuals with Parkinson's disease must be intensive, must be specific. You can see how we can increase complexity, and it must be meaningful in order for it to be effective and to carry over in your real world. It's great if we can get changes in our treatment room, but that's not where you live. We want the changes to be effective out in your everyday life. Remember that you may not realize how small or slow your movements really are, how soft your voice is, and that's directly targeted in these treatments to help you on your own be able to get to normal movement and normal loudness and feel comfortable with it. Your therapist will not let small movements or soft speech slip by, constantly be reminding you where that needs to be so you can target that on your own. Always remembering why you're practicing LSVT Loud and LSVT Big. It's not about just doing an ah or doing a particular movement. It's about how it translates into your functional everyday world. Don't be afraid to work hard. That's what makes the change. You will be amazed at what you can accomplish. So many times my patients have told me that how empowered they feel after these treatments because they had no idea what they were capable of. And most of all, we hope you have fun with the treatments. I'm now going to turn it over to Laura for a bit of wrap-up and to take some questions.
All right, thank you, Angela, and thank you, Heather, for a great webinar. I thought this was really valuable information, and I hope you did too. Thank you for sticking with us. I know that we've gone a little bit long, but we will stay on for a few more minutes for questions. Before that question and answer time, I wanted to draw your attention to some resources specific to people with Parkinson's and their family members, or really anyone interested in Parkinson's disease. You are joining this webinar, so you know about our webinars, but if you're looking for other webinars, there are many that we have already done and recorded and are available on our website, lsvtglobal.com. Go to the tab that says Patient Resources, and then you can see webinars that are listed on demand. That means those have been recorded. You can listen to them at your leisure. And there's upcoming live webinars that we've posted that are coming through the end of 2016. We also have patient symposiums. All around the world, we have LSVT Loud and LSVT Big training and certification workshops. And on the second day of those live workshops, we have 2-hour patient symposiums, which are free to you. It involves an hour lecture, and you can stay for an additional hour to actually try some of the exercises that are part of the LSVT Big and LSVT LOUD treatment protocols. So those are really amazing opportunities that we'd love for you to take advantage of. And then lastly, another resource for you is the LSVT BIG and LSVT LOUD homework helper videos. These are DVDs that will help support you in your exercises as you go through LSVT LOUD and LSVT BIG treatments. And more recently, they are now available through Vimeo.com. You can download it or you can stream it so you can watch them from your device, your mobile device or your computer, wherever you may be. So I want to give you just a quick reminder on how to ask questions. I know that some of you are already probably in the midst of typing questions, but you can raise your hand and we'll call out your name to know that your microphone has been unmuted, and you can also type in a question in the question answer box. And lastly, after the webinar, you can email info@lsvtglobal.com. So we'll take time for a few questions. I see that someone does have his hand raised, and John Gillespie, do you have a question that you would like to ask?
Yes, I would like. I have a question.
Go ahead.
Can you hear me?
Yes.
If one has completed the LSVT course, and would it be appropriate to redo it in about 2 years if you needed to?
Yes, maybe Heather and Angela can both give their perspectives on the need for what we call tune-ups.
Okay.
Great. Thank you so much, John. Absolutely. Remember that Parkinson's changes. It is a progressive disease in nature. We are all aging and changes are happening to our bodies. We all need a little more motivation and help. So you may have completed the LSVT BIG program, been doing well, but absolutely, we at our clinic look at our patients at least every 6 months, sometimes out to 1 year depending on the level, but it is absolutely important to come back to the therapist, get a little tune-up on those exercises, learn how to make them a little more challenging, and maybe talk about some new things that you might be having difficulty with. So absolutely, it is a great idea to return back again.
Thank you.
Okay, Angela, I'm not sure if you wanted to add anything, but I think Angela's answer is probably the same.
Yes, I would completely agree. For LSVT LOUD, you also, it is very important to do those tune-ups, and therapists should be checking in with you at least every 6 months to see how you're doing. Sometimes people say they're doing fine. I may just chat with them a while. Sometimes they need to come in for 1 or 2 sessions. It's essential that you continue doing the homework you were given by your therapist at the end of treatment to keep your voice or speech strong or keep your movements to those normal levels. And also stay tuned because we're starting to promote weekly exercise groups for graduates of LSVT LOUD and LSVT BIG, and starting to train therapists in that, so there'll be more information about that coming soon as well.
Okay, thank you. And right now I'm not seeing any more questions, and again I know that we are past the hour and you probably have a busy day to get back to, as do our presenters today. I did want to mention to you that you can download your handout if you haven't already and print it, but we also emailed everyone an attachment of the handout from today's webinar. At the end of this handout, you'll see there's some additional information and resources, including how to receive LSVT LOUD and LSVT BIG if you are interested in doing so. What are some key questions that you should ask a potential LSVT certified clinician? For therapy professionals, if they're not trained, how to receive that training so they can deliver it. And then some of our LSVT LOUD and LSVT BIG upcoming workshops. And then lastly, there are some fabulous Parkinson's events coming perhaps to your community. So again, we'd encourage you to check those events out and get involved. So with that, we want to thank you for joining us today for today's webinar. We hope that it was helpful to you, and we hope to see you again for our next webinar. Thank you.